Bismillahirrahmanirrahim. So our next topic after stroke is we're gonna discuss those. We're basically gonna discuss the differential diagnosis, in which we're gonna see the upper motor neuron features plus lower motor neuron features both in combined form. So first let's discuss the upper motor neuron features and lower motor neuron features separately, right? So in upper motor neuron, how we're gonna define this is an upper motor neuron, right? So just say this is a cortex and this is the Brahman in your 4, right? This is primary motor cortex. So from there the neurons descend to the, just say they descend to the medulla, right? And from that we'll have another set of neurons that are going to supply the specific group of muscles. So this one is called as the corticobulbar fibers. So these are the basically upper motor neurons, right? And this second neuron is called as the lower motor neuron, right? Similarly, if we're going to talk about corticospinal fibers, so they're going to descend, right? They're going to decussate at the medulla, right? And then they're going to descend on the contralateral side, and after that we'll have another set of neurons that are going to supply the specific group of muscle, right? So this whole neuron is called as the upper motor neuron, right? And this whole neuron is called as the lower motor neuron, right? So let's come back to a discussion. So upper motor neuron is defined as the motor neuron that is extending from the motor cortex up to the cranial or the spinal nerve nuclei, right? So we'll have these nuclei here. This one is a nucleus and this one is a nucleus. So this is called as the upper motor neuron, right? Talking about lower motor neuron, so motor neuron that extends from the cranial or the spinal nerve nuclei, and they go up to the motor end plate, right? That is called as neuromuscular junction, right? Okay, so this is the motor end plate, right? So this is called as the lower motor neuron. So what's going to happen if we damage the upper motor neuron? So everything will go up, like the tone will go up, tendon reflexes is going to go up, and there will be planters if we check that. So that is called as Babinski sign. So we'll have the positive Babinski sign, right? So planters are going to go up, right? If we talk about lower motor neuron lesions, so everything is going to go down, like tone is going to go down, right? Tendon reflexes will be down, and we'll have the planters that are downgoing, right? Along with that, we're going to see the wasting of muscles, and we're going to see the fasciculations in these in the lower motor neuron lesion, right? If there is upper motor neuron lesion, so we're going to see the spastic paralysis in these patients. So there will be increased tone in the muscle, so muscle will be like this like spastic, right? There will be increased tone in the muscle, right? If we check the tone in the bypassive movement, so we're going to see that there is spasticity in this, there will be rigid muscles, right? So that is right. So if we talk about bulbar and pseudobulbar palsy, so in pseudobulbar palsy we're going to see the basically upper motor neuron. This is a type of upper motor neuron lesion, and bulbar palsy is a type of lower motor neuron lesion, right? Okay, we can see these pulses in motor neuron disease, right? So what happens, let's say this is the motor cortex, Broadman area 4, right? From here the neurons descend down up to the medulla, up to the pons, so they end up there, right? So this is the upper motor neuron, right? And from the here we have cranial nerve nuclei. Just say this is 7th or 8th or 9th and 10th, basically 9th, 10th, 11th and 12th nerve nuclei are involved in pseudobulbar and bulbar palsies. So from here the this next neuron is gonna go, and this is gonna end up over the neuromuscular junction, right? So let's talk about the what's gonna happen if we damage this neuron, right? Lower motor neuron, that is called as bulbar palsy. Bulbar palsy is called so because medulla is also known as bulb-like structure, right? So if we damage that, so we're gonna have all of these cranial nerves are gonna get involved, right? So patient is gonna have, because 9th and 10th and 12th are related to deglutition of the food. So we're gonna have the dysphagia, right? And also called there is when there is difficulty in voice production, right? So this is called as dysarthria, right? Basically difficulty in articulation of voice. So cause, if we discuss the cause, so brainstem tumors can cause that, aneurysms can cause that, there is syringobulbia that can cause that, right? So these are the causes of the bulbar palsy, right? So if we examine this patient, so we can see the fasciculations in the trunk, right? So since 12th cranial nerve is involved, so we're going to see the fasciculations. There will be flaccidity in that, right? So if we check the vocal cords, so they will be toneless. So in these patients, there will be toneless voice, right? And if we check the jaw jerk, so this will be lost in these patients, right? Okay. And another thing is that if we check the um, gag reflex, so gag reflex will be involved, right? Gag reflex will be absent in these patients, right? So that's all about the bulbar palsy. Basically, we'll have the lower motor neuron type of lesion in these patients. There'll be, because of the involvement of 9, 10th, and 11th, 12th cranial nerve, there will be dysphagia, dysarthria in these patients, right? So I have discussed the causes, and on examination, what we'll be finding, I have discussed that, right? So in the pseudobulbar palsy, so this is the upper motor type of lesion. So everything will gonna go up, like there will be spastic tongue, right? There will be spastic speech, that is called as Donald Duck speech, right? Okay, and if we check the jaw jerk, if we check the gag reflex, so this will be exaggerated, right? This will be exaggerated. So let's discuss the causes of that. So cause is mostly the multiple sclerosis and the stroke, right? So stroke and multiple sclerosis is gonna cause the cerebral palsy, right? Okay, so that's all about the bulbar and cerebral palsy. So let's move on to our main discussion. That is we're gonna discuss the differential diagnosis of the upper motor and lower motor neuron lesions. So let's move on to the next page. All right. So first, let's discuss a case related to this. A 63-year-old female has presented with progressive weakness of upper and lower limbs. So upper and lower limb both are involved. On examination, limbs are wasted, right? So limbs are wasted, having fasciculations, right? So with loss of deep tendon reflex, if it is lost, so we see that we check that deep tendon reflexes are lost in the lower motor neuron type of lesions, right? So if these are exaggerated, we're gonna think about the patient is having the upper motor neuron lesion. So if we check the tone, so that is increased. So this is basically tone is increased in upper motor. There is upper motor neuron lesion. There will be increased tone, right? There will be spasticity, and if we check the planters, so these are going up, right? So we'll have the lower motor neuron features and upper motor neuron features, right? So this is the upper motor neuron features, right? So we have the mixed disorder, right? Mixed disorder in which we're going to see the both upper and lower motor neuron features. So let's talk about that. So if we check the planters, so in these patients we check the planters, they will be going up, right? Like there will be, this is a feature of upper motor neuron lesion. And loss of knee jerk, if we check the knee jerk, so it is lost. So this is a basically lower motor neuron feature, lower motor neuron type of lesion. And if we check the ankle jerk, this is also lost. So this is the lower motor neuron lesion. So we'll have the mixed, basically patient is having the muscular weakness and the upper motor neuron will have the upper motor neuron lesion and will have the lower motor neuron lesion mixed. This is a mixed type of disorder. So let's talk about what are the diseases in which we see the upper motor and lower motor neuron lesion in combined form. So the mnemonic is the MAST, right? MAST cells. So MAST mnemonic, right? So M stands for motor neuron disease, right? M stands for motor neuron disease, in which we have the five subtypes of this thing, right? Five variants of this motor neuron disease, right? Then A stands for ataxia, right? That is basically Frederick ataxia, right? And S stands for subacute combined degeneration, right? And T stands for Tabes dorsal. So these are the diseases in which we're gonna see the upper motor and lower motor neuron feature in combined form, right? So maybe these people they're gonna have the flaccidity in their spasticity in their lower limbs, right? And if we check the reflexes, they will be absent, right? Normally when we see there is spasticity, so reflexes should be exaggerated, right? If we think about stroke, so right. So if patient is having combined of upper motor and lower motor features, so we're gonna think about these diseases first, right? So let's talk about motor neuron disease first, and it's for the subtypes. Okay, so let me add one thing here, that in motor neuron, this is a pure motor type of feature, and rest of these will also have the sensory symptoms as well, sensory symptoms. And we can see these sensory pathways are involved mostly in the pathway that is involved, that is called as dorsal column, right? Dorsal column will be involved in these patients, right? So let's discuss the motor neuron disease. So right, I'm going to discuss this motor neuron disease in the next video, right? That's all for today.